northern Uganda and South Sudan. They had some of the world's worst maternal and child health indicators.
Our problem resulted from 20 years of conflict, civil war.
Women were not able to access ANC services, delivery in hospitals, and even postnatal care.
We wanted to see what can be done, what barriers are there, and what opportunities are there, especially at the community level.
So the project was focusing on how to put programs in order to reduce maternal death. We found that many of our women are dying from causes that can actually be prevented through knowledge and skills.
First, we did a long period of formative research to try to understand what's going on. What do people want? What do women want? What's the reality in the health services, both in the hospitals and in the clinics?
Our focus was very much in the community, women at the center of their own health, as protagonists, so to say. We create what we call MML, mutual mobilization and learning.
A process of participatory learning action cycles with women's groups on the ground. And there we didn't want to create new women's groups. We worked with existing groups. So we integrated a health-focused series of participatory action learning cycles within these groups.
The project focused at sensitizing and raising the awareness of women leaders who are empowered, who are given capacity in order to identify problems like that, problems which cause increased risk for mothers and for children, so that they can be able to inform other women to make informed choice.
And in a similar way, at the facilities, we also wanted to create these similar levels of leadership and empowerment to the health workers to tackle the health challenges at the health facilities and so bring improvement.
Pregnant women from those localities, in order to access the service, they stay in their own area and are getting those services in those areas.
We're seeing action by community groups on things like building a bridge, where women are able to mobilize both the resources, the lumber and the work and the men to help build the bridge to make access possible. We're seeing more utilization and understanding of why prenatal care is important.
Women are now aware of their own rights, and I think they also do have courage to ask questions. And also been trying very hard to try to impress on them that they could be leaders. They identify the problems, the health problems they have, and they even try to suggest as to what the solutions. They actually mobilize resources so that they solve actually the problem.
We think that this can have impact, especially because of the change in mental state. I can do something for my issues. I don't have to wait for somebody to come from I don't know where so that my health issues can be attended to.
We have less women dying now than they were dying, say, 5 or 6 years ago.